Have you ever wondered if that sudden hot flash or vaginal discomfort could be eased safely with a medication like Estrace? Welcome back to the Pharmacy Corner.
1. What is Estrace Estradiol? Estrace contains estradiol, a form of the natural estrogen hormone your body produces less of during menopause. It helps restore hormone balance to relieve uncomfortable symptoms. Available in tablets, creams, patches, and other forms, it is a widely used hormone therapy. 2. Main uses of Estrace. Doctors prescribe Estrace primarily to treat moderate to severe hot flashes and night sweats during menopause. It also helps with vaginal dryness, itching, and burning that can make daily life or intimacy uncomfortable. In some cases, it addresses low estrogen from other causes or helps prevent bone loss. According to Medline Plus from the National Institutes of Health, estradiol treats these menopausal changes effectively when used appropriately. 3. How it works in your body. Estradiol replaces the estrogen that decreases in menopause. This can reduce vasomotor symptoms like hot flashes and improve vaginal tissue health. It supports bone strength too, but it is not a one-size-fits-all solution. Your provider will decide if it fits your needs. 4. Common side effects. Most people tolerate it well, but possible side effects include breast tenderness, headache, nausea, or bloating. Vaginal forms may cause local irritation. Report any unusual bleeding, severe headaches, or leg pain right away, as these need medical attention. The U.S. Food and Drug Administration and sources like Stat Pearls note that side effects vary by individual and form of the medication. 5. Important precautions. Estrace is not suitable for everyone. It can increase the risk of blood clots, stroke, or certain cancers in some users, particularly with longer use or certain forms like oral tablets. The risks depend on your age, health history, and the specific type of estradiol product. Tell your doctor about your full medical history, including any history of breast cancer, blood clots, or liver issues. Regular checkups are essential. Avoid smoking while using it, as this raises risks further. 6. Who should be cautious or avoid it? Women with undiagnosed vaginal bleeding, certain cancers, or high risk for blood clots usually should not use it. Always discuss benefits versus risks with your healthcare provider for personalized guidance. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.